Cannabis and sleep disorders. Sleep disorder or insomnia, foreign language, insomnia, is a disorder defined following non-inadequate sleep results from a number of factors, such as waking during the night, difficulty falling asleep, waking up early in the morning, inability to falling asleep or problem that prevents quality sleep. Before use medical cannabis as a treatment for sleep disorders treatment mainly business cognitive therapy, relaxation therapy and acupuncture. Studies in the United States began in the early 70s of the last century have shown that medical cannabis as a treatment for sleep disorders also helpful and effective in patients chronically high. Cannabis and sleep disorders, the relationship between medical marijuana and sleep disorders. Medical cannabis patients are sleep disorders and other diseases reported that medical cannabis treatment contributes to a general relief and sedation. In particular relief to those who find it difficult to sleep due to the virtue of cannabis in reducing anxiety and depression, which are key factors in mental difficulty falling asleep. In addition to an increase in the values of the active ingredient THC in the cannabis plant, increases the feeling of serenity, improves mood and self-esteem and therefore helps falling asleep and sleep quality. Cannabis and sleep disorders, strains of cannabis to treat sleep disorders. The hemp plant is divided into two families with different features, sativa and indica. Steve known for a sense of uplift, or high. Steve strain linked to feelings of cheerfulness, increased creativity, helps concentration and is recognized inspiring influence. Indica is a strain of cannabis used in treating sleep disorders. Known for a sense of tranquility that is a job. As part virtues of cannabis indica strain, include treatments such as muscle pain, reduction of physiological pain, sedation, treatment of depression, migraine therapy and more. Cannabis and sleep disorders, how THC and CBD, the active ingredients in the cannabis plant, help with sleep problems. Helps falling asleep. The initial study that began in 1973 in the United States, found that THC molecule reduced the average time to falling asleep at both chronic patients and healthy patients. In 2013 carried out further research in the United States which showed that 20 milligrams of cannabis consumption before bedtime shortened the time to fall asleep at all subjects. Longer sleep. Studies have shown that consumption of THC or CBD improving total overall length of sleep. According to a study in August 2015 by veterans in the U.S. Army who suffered from PTSD, insomnia and anxiety showed a significant improvement in the quality and length of sleep. Deep sleep. Study published in 2008 showed that further phenomenon of active substance in cannabis. It was found that THC affects sleep cycles and largely contributing to combined deep sleep, of slow wave. Deep sleep cycle phase is the main phase of sleep. At this stage we incorporate memories and thoughts. Moreover, this is the stage in failing suffering from sleep. Increased REM dream phase. Another effect of the active ingredients in the cannabis plant is increasing eye movement phase characterized by dreamtime sleep. Research carried out in 2014 shows that the use of medical cannabis took the first step in REM subjects. But after a few weeks of this phase increased significantly with the consumption of active ingredients. Improving breathing. Medical cannabis use showed a significant improvement in breathing during sleep. About 25% of men and 9% of women who experience apnea, AHI, during sleep showed improvement until the total disappearance of the phenomenon. A study conducted in 2013 concluded that consumption of between 2.5 to 10 milligrams daily, significantly reduced the phenomenon of apnea began the short term. This is due to the improvement in activity in the autonomic nervous system regulates breathing. And given all the data, the studies in recent years suggest that research bodies such as the American Journal of Health System Pharmacy, Human Pharmacology and further intensify the research on cannabis and insomnia, due to the repeated successes of the trials of chronic patients and healthy people with sleep disorders.